commissioned service do you provide and to whom?
Welcome's a charity and we are part of SIAS, which is Solihull Integrated Addiction Service. We work in partnership with Birmingham Solihull Mental Health Foundation Trust, the Drugs Intervention Programme and Straight Up, which is Young Person Service, and we provide drug services for adults in Solihull.
How do your services support the Solihull Partnership priorities?
I think the service actually supports all of them, but it specifically comes under Solihull Safer Communities because we're commissioned by the DAT, the Drug and Alcohol Action Team. The reason we're under Safer is bringing people into drug treatment reduces crime. That said, I think that we tick the boxes for all of them, and an example of that is education and employment, making people of Solihull more affluent, for example. We do a lot of work around that, trying to get people back into work.
What benefits do you think VCOs bring to commissioned public services?
I think that we bring quality, excellent value for money, and partnership working, a really good example of partnership working. In fact, SIAS has won awards for the partnership working that we're doing locally.
What did you learn as you went through the commissioning process that could help others in the future?
I would just say that targets are very important when you're being commissioned. You have to work very hard towards those targets. You have to have your team behind you, and targets change and you have to move with those changes.
What difference has it made to your organisation being a commissioned provider?
The main thing obviously is growth. I know that Welcome started in a church hall in 2001 with 2 people and were very much at the time linked to the job centre. The 10-year drug strategy then happened and a lot of money got poured in locally into the drug action team, and so the service was commissioned from there and grew from 2 people to what we are today, which is 17 paid staff and 9 volunteers.
What advice would you give to potential voluntary providers considering bidding for commissioned services?
One of the things that I did was consult with my board recently on whether or not to go for a tender, and it's important to understand why you are going for that contract, and that should really reflect back on your own organisation's strategies for that year. The other thing I would say is make sure that you get some training in how to write tenders, because the process is very different to actually applying for grants. And also look at, if you are going for a tender, look at who else is interested in that tender and think about making partnership bids, because they often are much more preferable and stronger. So you'll have more of a chance of success perhaps if you make it a partnership tender rather than going for it on your own.